In this video, I'll talk about how to take a systemic history in the long clinical consultation of the MRCP PACES exam. If you're new here and you're just starting your preparation, watch the beginner's guide video first. It has the details about the marking scheme and the exam format. And if you want details on history taking, the history taking video is also up on the channel. So let's talk about the review of systems now. This is the part where most of the candidates mess up. Some of them either omit this part altogether, while others dwell too long on it and end up wasting their time, and they give the examiners an impression that they're not well prepared and they're looking for clues to find the underlying diagnosis or differentials. So we'll discuss how to effectively use it to our benefits. So moderation is key. It shouldn't be in such detail that you give the examiners the impression that you have no idea about the direction you're headed, and it shouldn't be really short, so you could possibly miss some associations or complications of the underlying diagnosis. So this part comes after you've explored the main symptom in detail and asked specific questions about the differentials you had in mind. So it should be from head to toe. The scanning of the review of system should be head to toe. But first, it depends upon the main complaint. Let's suppose the main complaint is headache. That means the CNS is involved. So you should ask all the questions about CNS first before heading into other systems. Similarly, if it's racing or pacing of heart, meaning palpitations, you should explore the cardiovascular system first, except in cases where there's multisystemic involvement. You'll do a thorough scan of all the systems, but we'll get to that shortly. So let's start with the CNS symptoms first. Let's suppose the complaint is headache or maybe seizures. You need to ask about headaches. Do you have any headaches? Do you have any dizziness? Have you ever lost consciousness before? And do you have any vision problems? And vision problems should be are asked in detail. You should offer some leading questions, such as, do you have any blurring of vision or double vision? Have you been bumping into things? So, bumping into things or maybe getting into frequent car accidents would mean that the peripheral vision is impaired. So, it can occur in both tunnel vision and in bitemporal hemianopia, as seen in pituitary adenomas. So, the patient may not overtly know about any problem with vision, but he'd be bumping into objects. So the next thing is any problem with your hearing, swallowing, or speech. Any weakness in any part of your face or body. Any abnormal sensations in your body, such as numbness, tingling, or pins or needles. Do you have any problem with your walking or balance? Then the cardiovascular system. For example, if the pain is if the main complaint is chest pain or maybe shortness of breath, you can ask about cardiovascular symptoms such as, do you have any chest pain? Where exactly is it? Do you have any racing or pacing of your heart or awareness of your heartbeat? Do you get breathless? And if they do, specifically ask about, do you get breathless while walking or walking upstairs? Do you get breathless when you lie down flat? Or do you wake up at night feeling breathless? So the last two questions signify orthopnea and PND. Ask about swelling around their eyes or ankles. For the respiratory system, ask about chest pain again. Do you have any cough? And quantify it if it's productive. Ask first if it's wet or dry. If it's wet, ask how many teaspoonfuls or how many cupfuls. So um, they can quantify it. So you can think about, if it's in copious amounts, you can think about bronchiectasis or wet lung conditions such as cystic fibrosis. Do you have you noticed any blood in it? Is it bright red? Is it dark? Are there any clots in it? Ask about breathlessness, any noisy chest. Noisy chest would mean wheezing. That could signify obstructive lung conditions such as asthma or maybe COPD or carcinoid syndrome. Ask about nosebleed. This question is often missed and it can point towards a vasculitis such as Wegener's, which is now known as granulomatosis with polyangiitis. So don't forget about nosebleeds if the main complaint is related to the respiratory system. Next thing would be GIT. So you can start from the mouth. Do you have any sores in your mouth? Do you have any difficulty in swallowing? Any burning in your chest? Any tummy pain? Feeling sick or throwing up? Any loose stools or hard motions? And if you want to rule out jaundice, do ask about, have you noticed any yellowish discoloration of your skin or your eyes? Or if there is, you can ask about, have you gotten any tattoos or any blood transfusions in the past? onto the endocrine system now. So while you're scanning from head to toe, cover all the glands that come in the way. So starting from the head, for the pituitary gland, you can ask about, have you noticed any change in your shoe size or your ring size, any change in your appearance? So in pituitary tumors or in acromegaly, you can find these changes. Do you have any nipple discharge for prolactinomas? If the patient is a female who just gave birth, ask about, have you been breastfeeding your baby? So it can denote towards pituitary apoplexy. Ask about periods as well. Next, onto the neck, the thyroid and the parathyroid glands. For the thyroid, ask questions about, do you have any difficulty adjusting to temperatures? So some candidates ask, do you have any weather preferences? It's too vague of a question, and it depends very it depends upon the patient's own preference. So it doesn't signify a thyroid disorder, because people may have their own preferences about weathers. So we were very specific. Do you have any trouble adjusting to extremes of temperatures? Then comes weight changes. Do not ask about weight gain or weight loss specifically. Ask about weight changes. That covers both. And if they do have any weight loss, ask about how much weight have you lost over how long, and whether it was intentional or not. So we can um, get an idea of whether it's significant weight loss or not. On the contrary, if it's weight gain, do ask about whether it was intentional or not, and which part of the body have they gained weight on. For example, is it all over the body? Is it just their tummy, or their face? Because a central obesity would be seen in Cushing syndrome. Then ask about, do you have any excessive hair loss? Make sure to use the word excessive. Any change in your bowel habits? So that would cover diarrhea and loose stools both. Any racing of your heart? This is to ask about palpitation seen in hyperthyroidism. Any shakiness of your hands? Don't use the word tremors. And about periods. The third thing is, so in the neck, the parathyroid glands, you have to ask about questions about hypercalcemia. So those are, any changes in your mood. Have you been feeling low lately? Do you have any tummy pain? Or and about constipation, any hard stools or hard motions? Do you have a history of kidney stones? This could signify hypercalcemia seen in parathyroid gland hyperparathyroidism. So on to the next part. So on coming on to the abdomen, you have to cover the adrenals, the pancreas. So for the pancreas, you can think about diabetes and insulinoma both. So for diabetes, you can ask about if they feeling thirsty more than usual, which is also a symptom of hyper calcemia. Then you can ask about, do you have any change in your waterworks, polyuria. Again, this can also be seen in hypercalcemia. Have you been feeling tired more than usual? Any weight changes? Dizziness is for insulinomas. If the patient has been feeling dizzy, sweating, or blackouts, that could signify low blood sugar levels. You can specifically ask them about, have you checked your blood sugar levels when this happens? Onto the adrenals. So again, it can cover Addison's disease and Cushing's. So you can ask about any weight changes, skin bruising, signifying Cushing syndrome, skin darkening, dizziness, loss of consciousness. This is to cover Addison's. And then for catecholamines, that is pheochromocytomas, ask about any shakiness of your hands, any episodic headaches, racing or pacing of your heart, and for Cone syndrome, which is hyperaldosteronism, ask about any muscle weakness. So in conditions where you're suspecting MEN syndrome, multiple endocrine neoplasias, cover all these symptoms. So pituitary symptoms, parathyroid, pancreas, cover all of these if you're suspecting a MEN syndrome. Next would be the musculoskeletal and or the connective tissue disorders. So thinking about any autoimmune conditions such as rheumatoid arthritis or SLE, maybe polymyositis or dermatomyositis, polymyalgia rheumatica. These are some common cases that come in the exam. So you can ask about joint pains, any tiredness, any skin changes, skin rashes, nail changes, um, and how does their skin react to sunlight. So that could denote photosensitivity. Skin changes or rashes would be again depending upon the part. If it's the face, think about SLE. Um, Ask about nail changes and any bluish discoloration of the fingers. indicating Raynaud's. So ask about the two or three color changes. Do they turn yellow, blue, or white? And do you have any sores on your finger pads, uh, denoting digital ulcers? Ask about proximal myopathy in both upper and lower limbs. You can ask them about, do you have any difficulty in combing your hair, for proximal myopathy of the upper limbs, and do you have difficulty in getting up from sitting position or walking upstairs, denoting proximal myopathy of the lower limbs. Next is the genitourinary system. Ask about changes in your waterworks, such as the color or the frequency. Ask about any abnormal discharge or any sores in the private parts. If it's a female, do not forget about the three P's, which is, are your periods regular? Are you currently pregnant? Do you have any children? I'm sorry to ask you this, but have you ever had any miscarriages? And are you on any birth control pills? Do not forget about these questions in a female patient. Problem with the abnormal discharge and sores on private parts should be reserved only when you're suspecting any STD, maybe reactive arthritis or HIV, and shouldn't be asked in all cases. Similarly, a problem with intimacy. This is asked in patients, for example, who are diabetic and you wanting to know about autonomic dysfunction, so, which can be seen with erectile dysfunction. If the patient does have erectile dysfunction, um, ask them about if they have any problem in initiating the act, or if it's a problem with the urge. So it's libido versus erectile dysfunction. Problem with the urge would indicate libido, could be seen in depression or psychological conditions, and erectile dysfunction would be an organic cause. But do ask about, do you get erection in the mornings. So if the patient is able to get erection in the morning, so that would signify that the problem is psychological as opposed to organic. If the patient is having trouble with erection in the morning as well as during the act, um, this means that it's an organic cause. So the next thing is just a review of a map, a head to toe scan, starting from the CNS, respiratory, CVS, onto the GIT, and then covering all the glands in between: pituitary, thyroid, parathyroid, pancreas, adrenals, onto the muscular skeletal system and the genitourinary. So, in conditions which are multisystemic, the most common ones being diabetes, SLE, sarcoidosis, mixed connective tissue disorder, and vasculitides. So, in this condition, after exploring the presenting complaint, asking some specific questions about differentials, do a quick scan of all the systems, because it can involve anything. For example, sarcoidosis can be sarcoidosis. It can involve the heart muscles as well, the joints, skin, everything. Similarly, diabetes can affect the eyes, the kidneys, or autonomic neuropathy, peripheral neuropathy. Similarly with vasculitides. So it's important to do a thorough review in these cases. And these are a few examples. So starting with how to not go into much detail. Starting with the main complaint, let's take cough for example. So cough can be in both cardiovascular and respiratory systems. Ask a few questions. Ask about, is it productive or wet? If it's wet, it's unlikely to be cardiovascular related. So go on to the details about the respiratory system, and then ask about the cardiovascular system. At this point, you'd be able to narrow it down to a system. For example, if you think it's heart failure, you don't have to ask detailed questions about the neurological system in this case. So ask the details about, any um, previous histories, past medical history, swelling around eyes and ankles, orthopnea, PND. Ask about any medications that he's been taking. Ask about, the impact that this complaint is having on his life and his job, and then do a quick review. You can give a disclaimer. I'd like to ask you a few questions. You can answer in a yes or no manner, and do a really quick review. Asking about, any change in their waterworks. In every case though, ask about fevers, weight changes, any night sweats or lumps or bumps. These are some questions that signify red flags, so they shouldn't be missed in any case. So this is how you should be very focused. Accept these multi-system disorders in multiple endocrine neoplasias, in autoimmune conditions, and in autoimmune polyglandular syndromes. Ask a detailed history, a scan of head to toe. Otherwise, stick to the main complaint and ask very specific questions about the differentials you have in mind. So if you have any more questions, please leave a comment. If you want me to explain something else, if you have a topic in mind, please you can leave a comment, DM me on Instagram. You can follow us on Instagram, Paces Guide. I have templates there about the history taking, the specific questions to be asked, and I upload some frequent interactive quizzes almost daily. So you can follow the page there. If you want one-on-one coaching for both LCC and communication, you can send me a DM for more details. Thank you for listening.